I'm pleased to be joined today on Health Beat by Dr. Andrew Baldwin, an ophthalmologist with Faith Regional Physician Services, Ophthalmology in Norfolk. And today we're going to be talking about abnormalities in the eyelids. And so what could you tell us about that?
Absolutely. Thank you, Rob. Sure. So people can have abnormalities either in the upper eyelid or lower eyelid. Starting in the upper eyelid, one of the most common abnormalities is excess skin of the upper eyelid. What happens is that excess skin can start drooping into a person's upper part of their vision, can even rest on a person's eyelashes and push those eyelashes into the vision. Or people will say, hey, I have to walk around with my eyebrows lifted to keep that skin out of the way. It's called dermatosis. Okay. It requires an outpatient surgical procedure to fix it. What we do is we go in and we remove a strip of skin, muscle, and fat, and then use a running suture and stitch it back up. People go home the same day. We see them back about a week later, remove those sutures, and then they go on with their life.
I see.
As for the lower eyelid, a couple of more common abnormalities are due to laxity of the lower eyelid. What can happen is if you imagine the lower eyelid like a hammock between two trees, you have an attachment towards your ear and towards your nose. If that attachment gets loose for any reason, that hammock can turn out or it can turn in. If it turns in, we call it entropion. And you can imagine if the eyelid turns in and the eyelashes are rubbing against the eye every blink, it's very irritating. If the eyelid turns out, people most commonly describe redness of their eyes, tearing, irritation. Both of those are fixed similarly in an outpatient surgery where we tighten the lower eyelid and that fixes it such that it won't flip in and out. When the eyelid flips in, we do have to do one extra step in addition to tightening the lower eyelid. However, both are outpatient surgery. Much like the upper eyelid, the lower eyelids, they go home the same day. We see them back in a week, and people do very well with those surgical procedures.
Just almost make it too easy.
Absolutely.
And that's Health Beat, brought to you by Faith Regional Physician Services.